it's a partisan crowd.
Well, you deserve it. That was a serious and comprehensive overview of the problems facing the veterans community, and we thank you very much for that.
Thank you.
And we're going to do our best to follow up on all of the issues that you raised. Let me begin by asking a couple of questions, one on budgetary issues and one on the unemployment situation. As I mentioned in my opening remarks, there is a proposal floating around which would reconfigure how COLAs for Social Security beneficiaries and disabled veterans are calculated. What that proposed change in the annual cost of living adjustments, COLAs, are calculated would mean that veterans who started receiving VA disability benefits at age 30, not uncommon, would have their benefits reduced by $1,425 at age 45, $2,341 at age 55, and $3,231 at age 65, according to the Congressional Budget Office. Commander Hamilton or anybody else at the table, could you describe for us the real-world consequences that using the so-called chain CPI would have on disabled veterans and surviving family members?
Senator, thank you for the question. I think our disabled veterans have given enough, period. They've given enough. And obviously, we're opposed to that. We remain opposed to that, and we'll always be opposed to that. It'll, you know, when people live on disability and live on that, it's an increased hardship for them, and we'll continue to do so. We'll be happy to talk with you, our people, with your people about why and how and whatever. But
I think what you're saying is that you perceive the benefits now not being overly generous. Is that right?
Absolutely right. Absolutely correct. You know, there's a guy in here named Mike Ferguson, Senator, who's one of my heroes. Mike was a young Marine, lost both his legs, both above the knee. Okay? You can never repay that young man for his service to this country enough. 1% keeps us free. Take care of our heroes. Take care of our heroes.
And the only point that I want to make is the theory behind this is that we have, quote unquote, been too generous in cost of living increases. I know, that's right. People laugh. That's the theory that's circulating around here, and that's the theory we want to defeat roundly, I think. Second question, Mr. Commander, and that is regarding employment. You touched on this issue.
Yes, sir.
Based on the feedback that you received from VFW members around the country, what recommendations do you have for Congress as we continue to work to provide service members and veterans the tools they need to successfully transition? Can you comment on the employment situation?
Yes, sir, I will. I think we need, obviously, a nationwide Hire a Vet campaign. Veterans are great employees. They're trained. They're disciplined. They know how to stay on task and take care of the mission. And something else we need to do is make the tax credits a little less red tape so the small business who can't afford to hire 3 CPAs and 2 attorneys to figure out how the hell to, I'm not supposed to talk like that, I know I do. But I do sometimes, okay? I'm still a sergeant in the Marine Corps with tattoos. But we got to make it simpler so the average business can understand the law and get around the red tape and do what they need to do to hire our people. You know, it should be to put people back to work, not to fill out forms and hire accountants. My answer.
Okay. Commander, thank you very much. Chairman Miller.
Commander, the secretaries testified and also talked to me in different meetings lately about meeting their goal of clearing the disability backlog by 2015. They are absolutely convinced that they're going to be able to do that. And I've asked this question of each organization. Do you think they're going to hit their goal of 90+% accuracy, 125 days or less by 2015?
Mr. Miller, you're a great friend of veterans, and I appreciate what you do. I do, from my heart. Floridian to Floridian, I believe in you. But I want to tell you something. We've heard this, and I hope that I'm wrong. I pray to God every day. I grab a knee and say to the sergeant major upstairs, let's get it right. Let's take care of our heroes. But I've been listening to this for 35 years since I've been fighting for veterans' rights. 35 years I've heard this. I hope we get it right. I hope we get it wrong. That's why I say we need to take our time. Don't be in a hurry. If we put it out, for God's sakes, let's make it right. Let's make it right. Let's make it right. Are we going to make it by 2015? I hope so. I really don't know.
I appreciate your comments too, because there's a lot of faith being put in the VBMS system, and they're saying that that's going to be the solution that's going to solve everything. But if you don't have the proper personnel actually inputting information, doing what needs to be done, the right attitude, it's not going to get better. And, you know, I appreciate you saying that those that are in there that are not doing their job should move on to something else.
You betcha. You know, absolutely. Mr. Miller, I met with the president a few days ago and discussed with him that very issue again. And I want to believe. But having said that, if we can't come up with some kind of program and see this VBMS, I pray works, and if it doesn't put us in a path to where we're going, and we don't see positive change, you know, heading toward 2015 and doing the right thing, well, you know, exactly what you said. Maybe it's time for some people over there in the ivory tower to find himself a different job. And let's get somebody that can do the job. And I thank you for your comments.
Thank you, Mr. Chairman. I yield back.
Congressman Michel.
Thank you very much, Mr. Chairman, and thank you, Commander, for your testimony this morning. And I agree with everything you said this morning. When you talk about veterans being forgotten 2 or 3 years down the road, and Congress's attention is going to be focused on something different, that is a huge concern that I have as well. Over the past few years, we've been very fortunate to provide a lot of the resources, but later on down the road, that's a big concern. Is the VFW or the other organizations looking at longer term? We've always been focused, and rightfully so, on the crisis that we have in front of us. But my concern also that we need that longer term vision, such as our aging population, what's going to happen when the soldiers coming back from Iraq and Afghanistan, and the movement to where they locate, whether it's in rural areas or urban areas. Have you focused on longer term vision? Or do you think the VA is doing any long-term vision?
Well, sir, yes, we have and do and continue to. And as Bob Wallace and his staff in Washington meets on a monthly basis with the Secretary and his people, he expresses concerns, not just about what's happening now, but what's happening next year and down the road. You know, I think sometimes in life, poor planning, clean this up. Poor planning prevents, prior planning prevents poor performance. And in some cases, I don't think we've done that. I think sometimes, one of the things that impressed me about the president, he looked at me and said, John, you know what? I do not intend to leave this mess to the next president. I said, Mr. President, I hope you mean that. I want to believe that as well. He was talking about the backlog. He was talking about where the VA was going, how we're doing. And the VA is doing some good things, you know? Sometimes you have to say thank you. Sometimes you have to kick somebody in the tuchus because they're doing poorly over here. But you need to thank them for what's happening over here. And the VA gives some quality health care, and they do some good things. I was in Puerto Rico and had a little health problem, and I was wounded 3 times. I didn't duck very well, so I got some health issues now as I've gotten older. And I was in Puerto Rico doing a thing down there and had an issue, and I said, so I called a friend of mine. Well, he's here, Francisco, and some other guys from Puerto Rico, and said, I need to go to the doctor. Where do I go? And they said, the best healthcare system in Puerto Rico is the VA. So I went to the VA and had wonderful care. But to tell you what was really interesting is they put my name in there, my, Johnny Hamilton, and they put in my last 46967, and it popped up, and I was just my primary care guy about 10 days prior to that, and he'd read the results of my lab work and what was going on, Now, only in the VA healthcare system can you do that in the world. That's it. Can't do it in DOD. So we need to, and I'm not real bright, but I understand, I get this. You know, it's amazing to me that we build all these systems and spend millions of dollars and they can't talk to each other. Are you kidding me? So maybe it's time we think and rethink how we do this and plan long-term to answer your question. I get off on the side sometimes and get a little, they'll tell you a little over here. So maybe it's time we did that and made sure we plan for the future so we don't get ourselves in these little crackerjack deals again. But he keyed all that up and had my meds and what I was doing and what I should do and got excellent health care. Now, that says a lot. That says a lot for the VA. You know, I don't always agree with everybody sitting up at the table politically or the president, but I thank the president for some of the good things he has done. I don't care if you're a Democrat or Republican, it doesn't make any difference to me. You know? Let's take care of our heroes. Let's take care of our heroes. Let's take care of our heroes. That's what we're here for.
You'd mentioned some of the problems with some of the, you know, facilities, VA facilities around the country and staff issues. And the Secretary, I think, definitely does want to do a great job. We always talk about a seamless transition between Department of Defense into the VA system, right. But quite a few of the reports I read from the GAO and the Inspector General talks about the silos, quite frankly, within VA. Veterans Health, you have Veterans Benefits, cemeteries, and sometimes they don't talk to one another, right. Although they say they want to, you know, they are working together. Do you think that we should look at realignment of the VA system similar to what they actually have in the Philippines, where someone's in charge and the VHA, VBA cemetery report to that person in charge in the region? And my time's running out, so if you can just do a quick response.
I'm good. What are you waving at me for? I am. Bob?
If I could answer that.
I'll let Bob answer that question.
I don't think we have to, at this point, realign VA. I think that Secretary Shinseki and former Secretaries of Defense have started to knock down those walls so that there aren't those silos. But your continued aggressive advocacy and oversight of it, I mean, for 25 years, the United States Congress passed bills and said, VA and DOD talk to each other, make this thing seamless. I mean, it's unconscionable and unacceptable in today's environment that when somebody goes into the military, they don't get one record, as their personnel record and a deployment record. It follows them right through. So if there's ever an exposure to environmental hazards, they can say the 1st Marine Division was there, they can push a button and everybody can be told to come in and get taken care of. And then when they're leaving the military, just push another button, it goes to the VA seamlessly. I mean, that's what the ultimate goal has to be. And I think that they're moving in that direction, but they need a few more kicks from folks like you to make that happen. But I don't think we need to realign them at this point. Just re-attitude adjustment.
Thank you, Congressman Michaud. Senator Bozeman.
Thank you, Mr. Chairman, and again, thank you, Commander, for being here. For you or your team, in your testimony, you stressed the importance of maintaining the highest level of training and credentialing for VA personnel charged with providing mental health services to veterans. What steps do you think VA can take to ensure veterans receive the highest level of care from professionals trained to meet the needs? In other words, you indicated, you know, what do we need to do about making sure that we have people that are credentialed and have the highest level of training?
If I could answer that, Senator, I think one of the issues is that we're very concerned that as VA ramps up their hiring of mental health clinicians, with now a drop-dead date of, I think it's June 30th, they have to have everybody on staff. That additional 1,900 that they had, that the Secretary announced he would hire, at that time they had, I believe, 1,600 vacancies, so that's 3,500. And in order to get to that goal, you had to hire 5,000. And the problem is we could stand outside with a roadblock for 2 days and we probably wouldn't find 10 or 20 that were competent to do mental health in the Department of Veterans Affairs. So one of the big concerns we have is that they don't lower the standards on what is considered a mental health clinician. They don't get somebody in with a bachelor's degree from the University of Wisconsin or anywhere else and just say, okay, with 3 weeks of training, you're a mental health clinician. So that's a difficult chore that they have, but it's one of the issues that we're very concerned about, that they don't lower that. And they have to continue to train everybody in the VA about awareness. From what we understand, 96% of the people who go to mental health in the VA are referred from a mental health clinician within the are referred from a clinician within the VA. That clinician then makes a determination in a referral when that individual should be seen. The other 3 or 4% are either walk-ins or someone who calls. And there's not a real system nationwide on who's answering that phone and who's triaging. Why are you calling? If somebody has enough courage to call, why are you calling? They don't have that, and they got to get that better, and they got to train and continually train everybody who has public contact, and even in the VA when they're outside with their friends, so that they understand the mental health situation that we face and the boiling points that may trigger something from happening.
One of the problems that we had for a while was, meeting various protocol by checking the box. Is that getting better? Do you understand what I'm saying? In other words, you're meeting the requirements, but you're doing it in a technical way. And as you said, with the call-in, as opposed to really getting to the meat of why the person's calling, again, just checking the box that this or that was done. Do you see that as getting better or continuing or a worsening problem? Or?
I would wish I could say yes. But the problem is when the pressure's on that they've got to hire these people by a certain date, we're very concerned on whether they're just checking boxes. I mean, real life experience is positive, and that all adds to it. And we want people in the system that are treating veterans to understand what their needs are and to understand what their experiences have been. Now, they don't have to be veterans, but that helps if they're veterans, obviously. But they have to understand that. Sure. And just checking the box, you're not going to get that kind of person at all times. And that could be a detriment to what we're trying to accomplish, all of us, by taking care of them in a dignified manner.
Right. Thank you, Mr. Chair.
Thank you very much, Senator. Congressman Kaufman.
Thank you, Chairman Saunders. First of all, I want to thank you all for your service to our country. I'm having served in the first Gulf War and the Iraq War. I'm a proud life member of the VFW, and I want to thank you again for being here. I want to raise a couple points and have a question. I think one point I want to raise when we talk about the backlog of the all the disability cases and the other cases that are out there, I really think that there's a fundamental problem with the culture within the Veterans Administration. And I think the best people to treat veterans are veterans. And I really think that, we need to change the VA's hiring practices to say that, not to change the standards for jobs, but to say that first they got to put it out to veterans, and only when they can't find a qualified veteran can they go outside the veterans community. I believe that will help change the culture of the VA, and I'm going to introduce that legislation pretty soon here to change that. I want to say, my father was a great soldier, World War II, Korea, Master Sergeant, retired Army, and in Colorado, where I transferred to the Marine Corps, he wasn't happy. He wasn't happy from the Army to the Marine Corps. But in 1969, I was 14 years old, and I volunteered at our Fitzsimmons Army Medical Center, which was the center for amputees coming back from the war in Vietnam. And it was a very dark time. I mean, the morale was bad. They were merely stabilized there and moved to often what were substandard VA facilities. And as the country became more and more divided about the war in Vietnam, they became more and more divided about their support for those who fought in that war. And those who fought in Vietnam were never welcome home. And I got to tell you, on this committee, I want to make sure that we never treat our veterans like we did for those who came home from Vietnam. That was wrong, and America owes them an apology. I think the signature wound when we look at Iraq and Afghanistan right now is post-traumatic stress disorder. And I guess my question, Commander Hamilton, is what kind of recommendations do you have from the VA in terms of what can they do to better treat those with that wound?
Congressman, obviously, as Bob Wallace spoke of, you know, the mental health is a serious issue. We've got to somehow find the ability to reach out and find quality people. I know that I'm treated, I'm 100% service-connected disabled. And fortunate though, I'm still walking and talking, so it's all good. But you know, we have a situation in Jacksonville. We just got a new clinic finally, been trying to get it for years and finally got a beautiful one there. But if you go into the mental health area, which used to be by the pharmacy, and I would go to the pharmacy. I haven't had occasion to go to mental health. There are those that tell you I probably should, but I didn't. But I'd go in to pick up prescriptions sometimes, and the receptionist would change with my shirt. The gal that answered the phone would change on a daily basis. So, you know, as Bob alluded to, when a guy calls in or a girl calls in, a gal, and they got a problem, they need to speak to somebody that can do something about that problem, not say, I'll give you an appointment a week from Thursday. You know, I mean, we're not talking about my toes sore here. We're talking about people that, in some cases, are ready to take their lives. So they need to make certain to have somebody there that's qualified to handle that. Quick story, and I'll shut up. We had a case, and this is the problem. Had a case in Florida. A guy called me, and he was held up in his trailer with a gun. And I knew this guy. So he wouldn't come out. He'd been drinking and taking whatever for about a week. And so I went over there, and he told the neighbor, if anybody comes there, I'm going to shoot him. And I knocked on the door and said, Charlie, this is John Hamilton. You're not going to shoot me, are you? Anyway, we got Charlie down to Gainesville. And, you know, I was told on the way down there, we don't have any space. I said, well, you better find some, because he's on the way and I'm coming with him. And it's not that, I mean, this wasn't a guy, again, that just was upset because the TV wasn't working. This was a guy that was ready to take somebody out or himself, or both. And, you know, we should, when someone has that type of issue or problem, then we need to take care of them now with mental health professionals to know what they're doing. So that's the problem. We got to reach out. And we did get him in Gainesville, VA, by the way. And he was taken care of. He's doing fine. But we got to somehow find those people, those quality people, and reach out to them and somehow get them in the system. Because, you know, as we've alluded to in my conversation and yours, you know, 22 suicides a day. 22 suicides a day. We lost more people to suicides than we're losing in the war. Something wrong with this picture.
Thank you. Mr. Chairman, I yield back.
Thank you, Congressman. Congressman O'Rourke.
Thank you, Mr. Chairman. And to Commander Hamilton and the members of the VFW, I want to thank you for your service to this country, and I want to thank you for your service to your fellow veterans. And I want to thank you, as the chairman said, for providing such a comprehensive overview of the VA today, the many problems we have, and some ideas on how we solve these problems. And when you talked about the claims backlog and the VBA and the lack of accountability and the error rate, and when you were asked about your estimate on our ability to fix this backlog within the promised time, and you said that you've been waiting for 35 years for this country to get it right. I wondered if you or your membership or fellow panelists could talk about if we're not getting these things right at the federal level, are there some local VAs, are there some states that are approaching these issues the right way that we can learn from here in Congress in Washington, D.C.? We heard last week testimony from a veteran who said that in Pittsburgh, they're turning around a claim in 30 days. We heard Ranking Member Michaud talk about the way the system's organized in the Philippines. There are some states that have been pioneers in workforce transition and hiring a vet. Where can you point us where we're getting the culture right, where we're getting the performance right, and where we can apply those lessons to what we should be doing here on the national level?
Sir, I'll let you, let Bob or Bill talk to that, but I want to say this. You look at Baltimore where they say the error rate was 40 to 60%. In the real world, those cats would be looking for a job. Okay, so whoever alluded to the problems up there of we got to get it right or we got to train the people to, or, he talked about replacing folks. Yeah, I mean, in the real world, it just wouldn't happen. So, I mean, there's places where things are better than others, but overall, with the backlog and the error rate, it's unbelievable. We have to, of course, something that we need to do as an organization. I'm talking to my comrades in the back. We need to make certain somehow we're trying desperately to get the word out to veterans. Don't file your own claims. Listen, if I need open heart surgery, I understand what they do, but I'm not going to cut my chest open and try to do it myself. We got professional people that know what they're doing. So we got to somehow get the word to those folks to come in here, because what happens is when they get an incomplete claim or something's found, it's got to go back again. And sometimes it goes back and forth 2 or 3 times. Now it's not a year, it's 2, it's 3 years sometimes. So we've got to do a better job. We, the veterans community, the VFW, are making certain that we get the word to those people. That's why this TAP program is so important. So when these people come out of the military, we can say, hey, here's what you get, here's what you ought to get, here's where it is. And we got people to review those claims on both sides of the coast, and they come back to make certain that they're correct. Because the average guy or gal doesn't know is, well, I'm getting 30%, well, you should have gotten 70. Now, the short answer, that's a long answer to that, but Bob, is there something we need to say about locations?
Congressman, in all fairness to VA, to VBA, there was a conscious effort made by previous Congresses and previous administrations to change the healthcare system from a hospital-based system to outpatient. Over the course of history, you can check the records, VBA was not funded the way they should have been. We have the finest, as John just said, he was in Puerto Rico, they pushed the electronic health record. VBA never sophisticated and went automation. The last few years, 4, 5, 6 years, we've seen a push for that, and they're playing catch-up ball. It's very depressing to go into a regional office and see all those papers. Very, very depressing, because each one of those paper files is some veteran that's waiting. Are there things that are happening good? Yes, there are. Fully developed claims is starting to catch on and starting to work, and those are the kind of claims that could get done in 30 days, diabetes, boom, boom, boom. I was in Atlanta a week ago to see a VBMS demonstration, and the folks that demonstrated it, along with the regional office director, were very enthused. They were very passionate about the changes that are going on. Chicago, the regional office director works very well with the veteran service organizations and is working the fully developed claims process issue to get fully developed claims in. I was in Salt Lake City and I had a briefing by employees, and the employees that were briefing us were very enthused about the change. They saw something coming that was positive. So there are some positive things coming, but in all fairness to VBA, they're playing catch-up ball. And they're playing catch-up ball, and with all the claims that they have, they need some attitude adjustments on some people, but they're trying to do what's right. I mean, I think most of the employees are trying to do what's right. I think General Hickey is definitely all in and is trying to do what's right, but there's so many parts to this puzzle that's moving that they're trying to put together that it's hard for me to tell my fellow VFW members or any veteran, be patient. Be patient, but I think we all have to be a little patient and give them a little bit of a wiggle room, because they're trying to get it right, and we want to make sure it gets right.
Thank you.
Thank you very much, Congressman. Senator Dean Heller.
Chairman, thank you. Thanks for holding this hearing, and I want to thank all the veterans that are here today for your service and your service to your fellow men. If I can just take a moment and recognize some of my friends that are here from Nevada. If you're going to fly 2,000 miles to make it to this hearing, you deserve it. A little bit of recognition. I have Gil Hernandez and Joe Rigsby here from Elko. Sure good to see both of you. I want to thank Bruce Hollinger from Hullendale, Bob Garlow from Boulder City, Dottie Marsh from Las Vegas, and John and Mary Stroud from from Hawthorne. Thank you very much for taking time to come out here for this hearing. Also, it's my understanding that in July of 2014, you'll be the VFW National Commander-in-Chief, if I'm not mistaken. Congratulations for that. Also, Nevada thanks you for your extraordinary service and your service in the Korean War in the Air Force. Thank you so much. And I hope to have an opportunity like Senator Rubio had to introduce you to in front of this committee in the years to come. So thank you. I've had an opportunity to speak with Secretary Shinseki and Hagel and talk to him about issues, Commander, that I think that are important, not only to Nevada but across this country. But the issues that I bring up is the issues we've been discussing today, and that's these backlog claims. We have 300,000 veterans in Nevada. We have 10,000 right now backlog in the state of Nevada. We're being told now by soldiers that they are to, once they get out of the soldiers, these men and women, once they get out of the service, to immediately file a claim, because it's going to take 1.5 to 2 years in order for that claim to be processed. They're getting apology letters, 3 or 4 apology letters before their claim actually gets filed. Can't they just process the claim instead of sending them all these apology letters? Second issue is TRICARE. In Northern Nevada, there's a new contract, and I'm real concerned about this new contract. It appears that you're going to pay more and get less service. And I don't believe that bodes well for this country and for what we're trying to do to help these veterans that have served for us. Third issue, and you've brought this also up, is veteran unemployment. We have a real problem in the state of Nevada, but especially in Southern Nevada, with the amount of unemployed veterans that we have. And I'm real concerned with this. They come out of the armed forces, these men and women with real skills, and yet they're asked to be certified in these skills that they have developed after years in the service. And it'll take them a couple of years to get certified by the states, the cities, and the counties. What can we do? What can we do here in this Congress to make sure moving forward that they receive, that we can slow this down, that we can get them employed as quickly as we possibly can without them having to go through this certification process?
Thank you, Senator. I appreciate that. You know, it's hard for me to believe that a guy can drive a truck in combat, but he can't drive one on the highways. Yeah. I mean, what the hell is that all about?
I don't understand.
Go figure the logic there, you know. I mean, you've got corpsmen that are out there in the field with the Marines that are doing everything short of open heart surgery, but he can't be an EMT when he gets home. Are you kidding me? So somehow or another, we've got to encourage our local and state governments to do the right thing and pass the right legislation. We've got to do something at the federal level. I don't know. Somehow we've got to reach out and do that. You know, it just doesn't make sense. It's such a waste of time, energy, and money. We talk about sequestration of money. Let's go have this guy spend another $10,000 so he can drive a truck in Atlantic Beach, Florida. Are you kidding me? Are you kidding me? It's not, I don't know. To me, like I said, I'm just a sergeant with tattoos, but some things are just common sense. And I appreciate your comments, Senator. We got to somehow work on that. We got to get that out before the people, and maybe the point in time will come where everybody in Florida will get tired of hearing it, and they'll pass legislation within the state mandating if you've done this, you get this. I mean, you can go in Florida. If you served in the military, you can go down and get a concealed weapons permit. You haven't got to do anything else. In fact, you served in the military, they understand you know something about weapons and guns. I was an infantry, I was in the infantry in the Marine Corps for a while, and I understand guns, so I'll go down and spend $400 to get something I already have, or to become a security agent, security guard. The school is $500. Well, I understand security. I provide security all over Vietnam to the best of my ability. So just doesn't make any sense. Doesn't make any sense.
Commander, thank you. Thank you.
Thank you, Senator, for those comments.
I'll be addressing the Nevada legislature later this month, and these are the very issues that I think the state needs to hear, and I'll be addressing them at that time. Thank you so much.
Thank you, sir, for your comments.
Mr. Chairman.
Thank you, Senator Hiller. Senator Hirono.
Thank you, Mr. Chairman, and aloha to Chair Miller, too. You were in Hawaii recently. Thank you very much for coming and talking with our people there. I also want to thank you, Commander Hamilton, for your very extensive testimony, Of course, welcome to all of the veterans who are here and their supporters. And like you, Senator Hiller, I have a number of people who have come even farther than from Nevada. They have come from Hawaii, and Mr. Chairman, with your indulgence, I would like to acknowledge their presence here. First of all, we have VFW Hawaii Department Commander Richard Ha'ake, and his wife, Ladies Auxiliary President Peggy. We have Ben and Anita Akuhito. We have Frank Bragg, Norbert Enos, Lanessa Wallace, and Randy Grant. As we say in Hawaii, e komo mai, welcome to you all. Commander Hamilton, I really appreciated the extensiveness of your testimony, and we can look at and address a lot of those areas, as I know we are. We're going to do the very best, and you've sat here saying that you've listened to us talking about wanting to attack the backlog for 30 years plus. I think one of the things that you said where you're going to offer help to the veterans so that they can get their applications in order so that their documents are not having to go back and forth for incompleteness. I think that is a really wonderful way to help the veterans with their completion of their applications, because it's hard. It's probably very complicated. One area that I would like to focus on is the help we provide to women veterans. And I note in your testimony that there is a huge percentage of them who have experienced sexual trauma while they were in service. So I would like to focus on the panoply of support that we can provide to them, and I realize that there are bills that we can do that with. In addition, though, you also noted in your testimony that there are many women veterans who don't know that they can use VA care and services, so the outreach to them is important, and that can be done, I think, through the existing, I hope, resources. You don't need a bill to be more efficient and effective. Can you comment a bit more on how we're doing in making sure that our female veterans are not only aware of the services, but that we equalize the kind of services we provide to them? And I noticed that we have on the panel Karen Nigara. Am I pronouncing your name correctly? I would welcome your thoughts and comments as well.
Well, thank you, Senator. I was going to kick that over in just a minute, but let me say this. The VFW is very much concerned about women in the military, sexual trauma, and their care. They stood with us, or they're standing with us now arm in arm, and have for a while, as veterans and as military personnel. We love and respect them. We want them taken care of just like we take care of every other GI, period. They're our comrades, period. Let me say, too, we need to, during the TAP program, we need to do a stronger outreach, I think, there. The college campuses, places where female veterans congregate, we've got to come up with some type of PR campaign. Again, just like the service we provide, to make them aware of what their benefits and entitlements are. But I would like Karen, who I'm happy to appoint as our National Legislative Chairman, the first female I think we've had in that capacity. She's a retired Lieutenant Colonel in the United States Army. She went to FSU, but don't hold that against her. I'm a Gator. But Karen, please respond.
Thank you, Commander Hamilton. I'd be happy to address that issue. As Commander Hamilton said, I was an Army veteran of about 25 years. I came in the Army in the early 80s. And in the early 80s, of course, we didn't define military sexual trauma as such. We all know it happened then, but we didn't have that defined. We didn't treat women and men for that. I'm also a disabled veteran. I use the VA health care as my primary health care, although I do have TRICARE as well. I've been very pleased with the VA health care. One issue I do believe, though, for women specifically is specialized women's health care in the VA. And the VA is fully aware of the need, and they are aware of the increasing numbers of women that utilize the VA for their health care issues. But one thing that I think is important, my career in the Army, I served with many infantry units from the company up through brigade and corps level. I was very used to and comfortable with going to see a doctor with a waiting room full of men. And being called in to see the gynecologist or whatever it might have been through a sea of men. I was used to that, and I'm comfortable with it. Not everyone is. I think it's essential that the VA realize that, which I think they do, and continue funding for specialized women's clinics where there is some level of privacy for specialized women's care. I am told that more women eligible for the VA use the VA than do males. And that's a good thing, I think. I'm very happy with my care at the VA. But I do think that we need to continue to be cognizant of the fact that there are specialty clinics required for women and that care, and privacy, a level of privacy is important.
Thank you. And as we see more and more women being in the military and becoming veterans, I really appreciate that concern, and I hope that this committee will particularly focus on the needs of our women veterans and their families. Thank you, Mr. Chairman.
Thank you, and we sure will. Congressman Paul Cook.
Thank you, Mr. Chair. First of all, I want to let you know that I also am a member of the VFW, and more important, my dues are up to date. That's all you care about, right? Whether I sent the check in. You know, great turnout. I was chair of the Veterans Committee in California. So I'm very, very sensitive to a lot of the issues. And Commander, I got to tell you, you're telling it just like it is. And, you know, sometimes you got to get the bureaucrats and the politicians to hear it from somebody that's down there. No acronyms, no five-syllable words, no statements that are written by lawyers for other lawyers that can only be understood by lawyers, and just get the straight scoop on what's going on. You know, where you have to wait this long for a claim is unset. And somebody on the panel talked about it, that we're not taking care of our veterans, somebody that's gone in harm's way, got hurt, you know, the whole thing, and I'm not going to regurgitate that. I just feel very, very strong. And just briefly, I want to tell you, this weekend I met with a lot of Marines down in Quantico. I did Old Home Week. I was down there 100 years ago, went to OCS, but I went to the Marine Memorial. And for all the Marines, hey, I'm a Marine, so I had to go to the Marine Memorial down there. And there's one part there, and if anyone hasn't been there, you go through this museum and you go through this tunnel, and you end up in a fuselage of a CH-46. Those of you who have crashed in a CH-46 or gone into combat with it, it's like instant, you know, post-traumatic stress disorder. You go into this, you come out, and then they have this mannequin of a dead body and a Marine and a corpsman standing over it. I mean, if you don't get it then, you will never, ever get it. So, you know, the only thing I'm really concerned about, and I also met with the secretary, and it was very nice of him to have breakfast. I don't think he's going to invite me back again because I kind of lost it a little bit because, you know, I just cannot accept this time delay. And we've heard this over and over and over again. I did bring up the issue, and I want your thoughts on telemedicine. Because far too often I have rural areas where you load up a number of veterans, they drive 2 hours, get to the VA hospital, they check off a few blocks, they got to come back, and they go all the way back. A lot of these things, and this is somebody who was born in Jurassic Park. I can't even figure out how to turn on a computer. But this would save a tremendous amount of time, and then you know, we could do some of these things in advance, so that once you have that face-to-face meeting with the physician or what have you, we can cut through that. And if there's a problem with the paperwork, we can cut through that right there. And so I do want to get your feelings on you know, where we have. You know, Skyping with, I see more of my grandkids now through the airwaves than I ever do because of the technology. And I'm just wondering whether we've underutilized that as much, and give you a chance to answer, but I just want to thank you so much for all your service and never forgetting the veterans. Appreciate that. Thank you.
Thank you, Mr. Cook, and hoorah to you. You know, again, like Bob Wallace said, we're playing catch-up ball. and I'm not the smartest guy in the world when it comes to technology, but it just makes sense. And I don't know well, no, I don't say that. But you know what happens is this new telecare is a good thing, and we need to somehow promote it and make sure everyone's aware of it because it does work, and it works in Florida. I had occasion. Personally, again, I tell personal stories because they're closest to me. I can tell you about them with my experiences. Where I had a problem at 2 o'clock on a Saturday or Sunday morning early, and I picked up the 24-hour deal and called and talked to a nurse in the Gainesville VA hospital, and got my questions answered, and it was what it was. So, but a lot of those things just basic paperwork. I mean, anybody can check that box. I can sign a form when I get there if I have to. Just makes sense, and we got to somehow promote that across the country and make certain we do, the VA does, we all do, when that guy or gal walks in there, a lot of that stuff's out of the way so I can see the doctor and get on to the next guy. You're exactly right, and we appreciate that. We've got to somehow develop that a little further. Thank you.
Thank you. Congressman Bilirakis.
Thank you. Appreciate it. Thank you, Mr. Chairman. Appreciate it. Thank you, Paul. And I know the Secretary will invite you back. But it's great to have you on the committee, that's for sure. And I want to thank all of you for your great service and your continued service for our true American heroes, our veterans, and I also especially want to thank our fellow Floridians. Welcome, Commander. I like your input on a proposal that has come from the Tampa Bay area community. It's called Heroes Ranch. The concept of Heroes Ranch is a long-term care facility, not a nursing home, that incorporates an interdisciplinary approach of both medical and age-appropriate rehabilitative services to our most severely injured veterans whose families are not ready or are not available to care for them at home. Again, we want recreational therapy, but also a family setting environment. Do you believe that such a care model is relevant and necessary? And I'd be happy to discuss it with you more, Commander, if you'd like to come to my office.
First off, thank you, Mr. Bilirakis. I knew your father quite well over the years. He was a great veterans advocate and did great things for us, so he's on our thoughts and prayers.
I'll tell him you said hello.
Please
He's doing great. Thank you.
Please do that. Obviously, we're supportive of anything within reason that's going to help our veterans rehabilitate and take care of their long-term care and needs. And we'd love for you to get our people involved up here, maybe Mr. Bradshaw or Ray or Bob Wallace to come by and sit down with you and discuss that. We'd love to do that, and we appreciate the offer, and we'll certainly contact your office and take you up on it.
Please do, because this is a priority of mine. Thank you, but I got to get your input.
Thank
you so very much, all of you, for being here.
And again, say hi to your dad.
I definitely will.
All right.
Thank you. I yield back, Mr. Chairman.
Thank you very much, Mr. Bilirakis. I think we have heard from all of the members. I just want to thank everybody up in the panel for great testimony. What you have done is raise virtually every significant issue facing the Veterans Committee. I think you're going to find a whole lot of agreement with the issues that you've raised and the ideas that you've brought forth on how to resolve it. We need your help to go forward to make sure that we do the right thing for veterans. And I know we're going to hold a number of hearings. We're going to be presenting a whole lot of legislation, and we look forward to working with you. Bottom line is, I think somebody earlier made a very important point and recalled what happened in Vietnam. In a democratic society, we are allowed to disagree. It's what democracy is about the wisdom of this or that war. That's called democracy. But in my view, I think what we are seeing in recent years is an understanding that you don't blame the warrior for the war. And we have seen that. I think that's significant transformation, differences of opinion about Iraq, but we're not blaming the people who fought in that war. We're taking care of them. So we've got a lot of work in front of us. I think what I can say is that these two committees, the House Committee, the Senate Committee, are going to go forward in a bipartisan way. We're going to fight for veterans, and we're going to do it with the support of the VFW and the other service organizations. Thank you so much for your excellent testimony today. This meeting is adjourned.